So my kids' challenging behaviors are usually very easy to spot. They're not always easy to tackle. So my 13-year-old daughter, or when she was 13 years old, she had challenges waking up in the morning, and they came on quite suddenly. She hadn't had this experience before. And the result was that it made her late to school because she would miss the school bus. So in our morning routine in our house, it was hectic, like most families are. And so adding a challenge of a 13-year-old not able to get out of bed in the morning really did make for more stress on everyone, really did strain the morning routines for everyone. So my initial response to the behavior was to react. First, I tried yelling. So, get out of bed now. And then, of course, get out of bed now or else. It didn't work. She still couldn't get out of bed in the mornings. She still really struggled, and we still were very strained at home. And because of the yelling, we were now irritated with each other. The next response was trying to natural consequence my daughter. So I thought, well, fine, wake up when you wake up, get to school when you get to school, and deal with the unexcused tardies. And unfortunately, this could work, but in her case it did not. And in fact, it actually made the situation worse because now she had increased anxiety and stress related to the problem as a whole. It was at that point I had to take a step back. I needed to find a better way to approach the situation as a parent, and also do some repair because we were now angry at each other. We did eventually make progress. We really did. It took some time. And it took a lot of effort and patience. When I look back on how we did accomplish moving from her not being able to get out of bed to actually finally independently being able to do so, I see there were 3 strategies that really helped me along the way. And the first was inviting my daughter to problem solve with me during that experience, and really building from our strengths. So, for example, in general, I was pretty good at being able to stop and really listen to her and consider her perspectives. And so for in this situation, I really did want to understand what she thought might be driving the behavior and what her input was. And that was my strength. Her strength, on the other hand, was she had a lot of insight about herself, and she was also really willing to stop and consider what might be part of the problem. And she was willing to try new strategies. So that partnering with my daughter was a really big piece to making progress. The second strategy was asking for help from others. So for example, when my daughter and I spoke, we learned that she was having trouble falling asleep the night before, which would then lead to her being sluggish in the morning. We also learned that she had challenges related to the alarm clock, which I wasn't aware of and she didn't want to tell me about because she knew it sounded odd. My daughter has a diagnosis of obsessive compulsive disorder, or OCD, and at times that can result in some challenging symptoms about how she responds to things in her environment, and it was definitely going on with the alarm clock. These pieces of information along the lines of also having tardies building at school really led us to the second strategy of having to reach out for help from others. And so we included the school counselor who agreed to check in with my daughter regularly from school about how things were progressing with her plan. We also included her mental health team, or mental health providers, who included a therapist and a psychiatrist. What can we do about the sleep challenges? What strategies or approaches could we take? My daughter has medication management through psychiatry because of the OCD challenges. So what do we need to know about this regarding the alarm and her stress level related to sleep and all of these other pieces? Communicating with these different supporters really made a difference for us in breaking through. The third strategy that made a difference was just taking good notes along the way. My daughter and I jotted down what's the challenging behavior. We jotted down the other challenges that we thought were connected to it. We wrote down what worked, what didn't work, what have we tried. All of these things we were able to write down in a simple format and keep good notes so that we could share them with the different providers involved with her treatment and support at school. And as a result, my daughter did break through. She's 15 years old now. She is doing well, able to get up in the mornings independently. On most mornings, like most 15-year-old, she does sometimes struggle to get up. What I like is that if there are early warning signs and she suddenly is starting to get sluggish with those mornings, we can check in right away instead of waiting until the problem gets worse. And we also know what works, and strategies that we've used in the past we can bring forth again and try for anything that comes our way.